a month. Hard to believe that May 1st is the 1st of May, or May 1st is Friday, excuse me. So the year is definitely going quickly. So I know this is a lunch and learn. I hope that you all brought your food because I really don't like competing with food. Um, so hopefully you brought your food, and this is just kind of some information for your viewing pleasures. So we're going to talk today about risk factors in stroke prevention and kind of some of the things you can apply to your life. If you want to go ahead, Julie, thank you so much for running those slides for me. Before we get into that, though, it's important to just talk about the human brain, in all its functionality and everything it does for us every day, just to get through the day, whether we're thinking about it or not. So the human brain is the central organ of the nervous system. It serves as the primary center for our entire body. Think of it as our motherboard, our processing chip. I'm full of parallels with you know to provide that brain example to you. Excuse me, I'm having some technical difficulties here. So despite weighing only about 3 pounds, it is the most complex organ that humans possess, and it's responsible for coordinating both the voluntary and the involuntary activities. What do I mean by that? So the brain controls motor functions, things we don't think about, such as our movement, our balance, our coordination. Also, while managing, our sensory functions, that allow us to see, hear, smell, taste, touch, feel. Every sensation you experience is received, processed, and interpreted by specialized areas of the brain. They allow you to respond appropriately in your environment. So beyond those basic survival operations that it feeds. Example, how many people actually sit and think about breathing? It just happens. That's involuntary. So beyond that, though, the brain also enables our higher level cognitive function, things that we do think about, reasoning, planning ahead. So I think some people said they might have some vacations coming up. So, planning that, problem solving daily at our jobs, and decision making. It's also the seat of memory, emotion. Our personality comes from the brain, consciousness, and shaping who we are overall as individuals. Structurally, the brain is made up of billions of neurons, or just a fancy word for nerve cells, that are communicate with each other. And this happens both electrically and chemically, moving across what we call synapses. These are intricate networks. Examples, for example, it's the broadband of the body. And they allow that information to move rapidly, efficiently throughout the brain and body. And the brain reaches its maximum physical size by approximately 18 years of age. However, development doesn't stop there. Through a process known as neuroplasticity, which has been the buzzword for about the last 3 years or so, which you may or may not be familiar with. The brain continues to change and adapt throughout life in response to learning, experiences, and potential injuries, and even environmental challenges. So everything you take in every day is being processed and you're adapting to it. This adaptability allows people to acquire new skills and recover certain functions after injury, sometimes even after stroke, and continuously adjust to our new situations. Understanding the brain's complexity is essential for appreciating how damaging conditions such as a stroke can disrupt vital functions and significantly affect our quality of life. So next slide, please. So now that we kind of have a basic understanding of the brain, What is a stroke and why do we consider it a medical emergency? Well, essentially, a stroke is a serious medical condition. It occurs when the blood supply to part of the brain is interrupted or reduced, and it prevents brain tissue from receiving the oxygen and nutrients it needs to function. Think of clogged pipes, in your sink. So it kind of if it gets clogged, it slows down or it just stops draining altogether. Very similar function. Because brain cells are really sensitive to oxygen deprivation, they begin to die within minutes of this, disrupted blood flow. Strokes are primarily affect the arteries that carry the blood to the brain, and they can occur either when blood vessels become blocked or when it ruptures. And we'll talk a little bit about the different types of strokes a little later on. The resulting brain injury can impact a wide range of functions, and it depends on the area of the brain involved. These effects can include weakness or paralysis within the body. You might have difficulty speaking or understanding language. You could have vision problems, changes, memory loss, emotional changes, and impaired judgment or behavior. A stroke is often referred to as a brain attack, kind of like a heart attack, because much like a heart attack, it requires immediate medical intervention. Prompt treatment is critical, as early restoration of blood flow can minimize brain damage. It can reduce long-term disability, and it can significantly improve survival outcomes. Delays in care can actually lead to irreversible injury and increased risk of death. So, essentially recognizing the urgency of stroke symptoms and seeking emergency treatment immediately can make a difference between recovery and permanent disability. Understanding what a stroke is and how it affects the brain underscores the importance of prevention, early recognition, and that rapid response. Next slide, please. So let's get into some of the key stroke facts. Now, I know some people get really excited with statistics, such as myself, and others get bored to death. But I think sometimes it helps to put that data out there just because it, is eye-opening. So I will have some statistics for you in the next few slides. So while stroke remains one of the leading health challenges worldwide and has a profound impact on individuals, families, and healthcare systems, in the United States, someone experiences a stroke approximately every 40 seconds. Every 40 seconds, okay? So that highlights how frequently the condition occurs. During an active stroke, nearly 2 million brain cells can die each minute, and emphasizing the devastating speed at which which emphasizes this devastating speed at which a brain damage can progress. So stroke is a leading cause of long-term adult disability and often leaving survivors with lasting physical, cognitive, or emotional impairments. While some individuals are able to make a full recovery, more than 2/3 of stroke survivors do live with some form of disability that may affect their independence and quality of life. Although the risk of stroke increases significantly after 55, strokes can occur at any age, including in young adults and children. And we'll talk a little bit about that and what that might look like. Importantly, stroke does not affect all populations equally. Example, if women experience more strokes annually than men, and Black individuals are significantly higher risk of first-time strokes compared to white individuals. These disparities highlight the influence of social, economic, and health-related factors. And despite its seriousness, stroke is often preventable, making education and lifestyle changes and early medical intervention critical components in reducing overall burden. Next slide, please. So as I mentioned, strokes in women are more prevalent. And, normally, if I was having a two-sided conversation, I'd kind of ask people, why do you think that is? But I'm going to tell you. So women tend to live longer. This is just fact. Women tend to live longer, so our risk factors go up. We experience 55,000 strokes more than men. That's not 55,000 strokes a year. That's 55,000 strokes more than men. So women have a greater rate of stroke disability. And the 32,000 excess stroke deaths in women in 2000 were steadily projected to increase to nearly 68,000 by the year 2050. Stroke affects 34 pregnant women out of 100,000 compared to 21 women out of 100,000 who are not pregnant. So pregnancy increases the risk because of hormonal status. Our hormones fluctuate, and that can be a risk factor as well. So men and women with stroke differ with respect to the prevalence of stroke risk factors. Women are generally older at onset by an average about 4 years and are more likely to have atrial fibrillation, which is a heart arrhythmia. So, they're and hypertension, so that combination. Whereas men with stroke are more likely to have a history of heart disease, heart attack, peripheral arterial disease, so vessel disease, diabetes, or alcohol and tobacco use. So you can kind of see the difference in those risk factors and between the men and women. So you can move to the next slide, please. So again, some of those statistics for those of you who enjoy them. So how common is stroke in the United States? Stroke is highly prevalent in the United States. We actually live in what we consider the stroke belt. It kind of starts in the south and hooks down. It goes south of Virginia, hooks down through Georgia and into Alabama and Mississippi and Louisiana. It's the highest prevalence of stroke in that area. So you can tell it's a major public health concern. So currently more than 9 million Americans are living as stroke survivors, many of whom require ongoing medical care, as I mentioned. And, that includes rehabilitation, support services. And each year, approximately 800,000 people experience a stroke. And about 185,000 of those cases are recurrent strokes, meaning they occur in individuals who already have had a previous stroke. Stroke ranks as the 5th leading cause of death in the US and is the 3rd leading cause of death among women, further illustrating its widespread impact. So again, very, very important that the early recognition of symptoms and rapid intervention remain essential for reducing death and disability related to stroke. Next slide. So now that we've just talked about, the brain function and, stroke, the urgency of stroke and why it's a medical emergency, we're going to talk a little bit more about the types of stroke. So, that you can recognize them. You can go to the next slide. So the most common type of stroke is the ischemic stroke. So fancy word, ischemic, for those of you not familiar with it, it just means like a lack of oxygen. So the ischemic stroke is the most common form of stroke. It generally accounts for approximately 87% of all stroke cases. For our area, I'm going to say that's a little bit lower. It actually accounts for approximately 80% of all stroke cases that we see in Roanoke. So this type of stroke occurs when a blood clot obstructs a vessel supplying the brain, and it significantly reduces or completely blocks the blood flow. Again, it goes kind of back to that, slow drain. So there's something clogging it. Maybe not all the blood and oxygen are getting by, or it could be a complete block where nothing is going down that drain. So the affected artery can become, can be clogged by a buildup of fatty deposits. It could be a clot formed elsewhere in the body that travels to the brain, or other heart or vascular conditions that create, the slowing or impeding the blood flow. When the blood flow is interrupted, the brain cells in the affected area are deprived of oxygen and essential nutrients. So it leads to rapid cell death. So this is why this is so important. The severity of an ischemic stroke depends on the size and location of the blockage, as well as how quickly treatment is administered. Common symptoms may include sudden weakness on one side of the body. It could be difficulty speaking, whether forming words, thinking of words, or responding to someone. Confusion, vision disturbances, you might get a hole in your vision, you might it might be blurry, or it could just, your vision could go out completely. So timely treatment, such as clot dissolving medications, we call them clot busters, or a mechanical removal of the clot can restore blood flow and significantly improve outcomes when someone is having a stroke. So understanding ischemic stroke is critical because early intervention can save brain tissue and reduce long-term disability. So going back to my example of, the clogged drain, we actually have these things that if it's a large vessel blockage, we have these things that essentially look like roto-rooters, and the doctors can go in and retrieve that clot in a lot of those cases, through the veins in your body up to your brain and pull that clot out. So very, very important to, to get treatment as quickly as possible. So next slide, please. So now that we talked about ischemic stroke, what are the other types? So a hemorrhagic stroke actually occurs when a blood vessel in the brain ruptures. It causes bleeding either within the brain tissue or the surrounding spaces. Again, if we want to go back and talk plumbing, this is when your pipe bursts. Okay, this isn't just a clog. There's a lot of pressure, a lot of buildup, and now your pipe has burst. So although hemorrhagic strokes account for only about 13% of all strokes, they're associated with a higher risk of death and severe complications. So going back to, nationally, we know that 87-13% split. But in our area, it's more of an 80-20% split. That's kind of what we see typical for our local population for strokes. So the rupture can involve large arteries on the surface of the brain or smaller blood vessels deep within the brain tissue. And then when the bleeding occurs, it increases pressure within the skull. Again, that pressure builds up, which can lead to rapid neurological deterioration. So, when it occurs, though, the surrounding areas versus just the vessel, the surrounding areas then are not receiving that adequate oxygen and nutrients, similar to the ischemic stroke, but again, it kind of expands that area. So common causes of the hemorrhagic stroke, they include uncontrolled high blood pressure, aneurysms, or ruptures, head trauma, if you hit your head hard, accident, something like that, and certain blood disorders, so something you might have a pre-existing condition for. Symptoms often appear suddenly, and they might include a severe headache, nausea, vomiting, loss of consciousness, or neurological deficits. So again, prompt emergency treatment is essential to control the bleeding, relieve the pressure, and prevent further brain damage. So due to its severity, prevention through blood pressure control and risk management is especially important. And we'll talk a little bit about how you can do that later on. Next slide, please. So this is just a little slide I borrowed from my coworker, Pam, who is our RN stroke program manager here at Roanoke Memorial. She had some really good graphics about subarachnoid hemorrhages. So this is a type of hemorrhagic stroke. A lot of people talk about how that when they experience this, it's the worst headache of their life. I mean, and some have reported that they felt a popping sensation right before it happened. So we also call it a thunderclap headache because it's like a thunderclap, that pop, that boom, and then, obviously symptoms. So subarachnoid is the space is the area between the brain and the skull. And you can understand then the increased pressure can crush the brain against the bone or cause it to shift and herniate. So again, can't stress enough, you'll hear me say it many more times again, that that emergency medical attention is urgent because we have to get that person to treatment to alleviate that. All right, next slide. All right, so we talked about the different types of stroke, main stroke. However, you may have heard the term called mini stroke, or also known as a transient ischemic attack, or a TIA. So several names there, but a lot of times people say, oh yeah, I had a mini stroke. This is what they're talking about. It's a TIA. It's a temporary interruption of blood flow to the brain, and it produces stroke-like symptoms. So unlike a full stroke, a TIA resolves on its own, and symptoms typically last only minutes to a few hours without causing permanent brain damage. However, a TIA should never be ignored as it serves as a serious warning sign of a possible future stroke, okay? So individuals who experience a TIA are at a significantly increased risk of having a major stroke in the days or weeks that follow that TIA. So diagnosing a TIA can be challenging because symptoms often disappear quickly or they come and go, but any stroke-like symptoms, even if brief, they require the emergency medical evaluation. A comprehensive assessment might include a review of your medical history, imaging of blood vessels in the head and neck, and tests such as CT scans, MRI, or angiography. And after diagnosis, follow-up care with a neurologist is essential to assess stroke risk and implement preventive strategies. Recognizing and responding to a TIA can be life-saving. So again, very important to know that it could be significant, a significant predictor of things to come. Next slide, please. So, all right, strokes in children. So strokes in children, although less common, still can happen. So blood clots can form in the heart and travel to the brain. This can be caused by congenital heart problems, such as abnormal valves or infection. So congenital refers to the condition present at birth. So sometimes if there's, a malformation, that can predispose the child to this. To a blood clot. At least 10% of children with sickle cell disease suffer a stroke because in sickle cell disease, the red blood cells can't carry oxygen to the brain, so blood vessels leading to the brain may have narrowed or closed, increasing that risk. So other risk factors, can include the hypertension in children, diabetes, obesity, cardiac disease, or even a neck injury or trauma. That can also happen as well. So hemorrhagic strokes are not often caused, are most often caused by rupturing, weakened, or malformed arteries, or AVMs. The risk of hemorrhage is higher with certain illnesses such as hemophilia. Again, AVMs are generally congenital and present at birth. So the interesting thing worth noting, though, is that this year, 2026, the American Heart Association, the American Stroke Association came out with updated guidelines in February. And those stroke guidelines now include recommendations for interventional treatment in children with acute ischemic stroke. There were not guidelines published previously. These guidelines emphasize early stroke recognition, just like everyone else, and suggest that some catheter-based treatments, or going back to those routers, may be safe and helpful for some children. These recommendations guide emergency stroke care for children, and they support those advances in treatment. So again, brand new this year, we have our very first guidance out on stroke treatment in children. So Julie, I'm counting on you to keep me honest for time. So, all right. So we're going to talk.
We're doing well. Thank you.
Okay, great. Thank you. So signs and symptoms. So let's talk a little bit about those. We can go to the next slide. So signs and symptoms, you can see here. This is this spot a stroke graphic you may have seen around, whether it's on a website, you might see it in the lobby of some of the hospital or some of the clinics, but we try to have this out there quite frequently. But it's how to spot a stroke. You can also find this on your, I don't have my badge on right now, but your little buddy badge. Your BFAST is right on your buddy badge if you ever need to refer to it as well. But, B is for your balance, if it's unsteady. E is for eyesight, any changes in that vision loss, things, as mentioned earlier. Face. So sometimes stroke patients, not all the time, but sometimes, and it's very common, a stroke patient or someone experiences stroke might have facial asymmetry, where one side of their face starts to droop. And so if they smile, they're only going to have a smile on one side. They're not commanding the other side of their face as well as they do their one side. A is for arms, but really that can extend to limbs on a certain side of the body, where it's weakness or numbness. I remember my grandma saying, she was experiencing a stroke and saying, I just don't feel like my arm belongs to me. So I think that's a great illustration of, that feeling. But so any type of weakness, not feeling right on that side of the body. S is for speech. Again, that getting the words out, being able to identify the words. And then the T isn't necessarily a symptom, but it's a reminder of time. Time is brain, and you always want to call 911. You don't want to get in the car. You want to call 911. You want to get you or your loved one to the hospital for treatment as fast as you can. So, all right, next slide. So why? So this gives you a little bit of an illustration of what happens in the first 6 hours when a stroke is occurring. So each minute, 1.9 million neurons, I think I said almost 2, or 14 billion synapses, and 12 kilometers or 7.5 miles of myelinated fibers are destroyed. So in the first 6 hours, you can see what happens there. In the 10 minutes, you have some tissue death. You can that's the first 10 minutes. And then in 1 hour, you can see more brain tissue dies, and it progresses from there. So without treatment, tissue dies and may result in severe disability. You might lose the function in your brain for that particular area where that stroke is occurring. So very, very, very important. So next slide. So next slide, we'll just talk about just how stroke can affect you. The weakness and loss of sensation depends on what side of the body, depends on where your stroke happens. So if your stroke happened on the left side of the body, you might experience weakness and loss of sensation on the right side of the body. So opposite. Speech and language difficulties might occur. We call that aphasia. The inability to read, write, and learn or process new information. On the left side of the body, or on the left side of the brain, right side of the body, you might be slow and have a cautious behavioral style. That's where it can go and affect personality. Reduced ability to do math, reason, and analyze things, and also memory loss. Whereas on the right side of the brain, if you experience a stroke, you might experience weakness and loss of sensation on the left side of the body. Your depth perception or direction may be impaired. You could have vision problems, your personality might become quick and inquisitive in your behavioral style. You might inability to paint or appreciate art and music. It's your artistic side of the brain. Your lack of ability to recognize emotions in other people could be affected. And again, on this side, on the right side, you could also experience some memory loss. Next slide, please. So, and we can actually go to, so what causes a stroke? We're going to talk a little bit about that. So here you can see a graphic that you will find if you ever see a patient discharged from RMH with a stroke, this will automatically populate on their after visit summary. So this is 80% of strokes are preventable. Okay, and this graphic shows a little bit of some of those lifestyle those lifestyle preventable risk factors, as well as the uncontrollable risk factors. So if you look here at this graphic in more detail, you can see some of the some of the lifestyle or controllable risk factors are physical inactivity and lack of exercise, carrying a little bit of extra weight, smoking, vaping, and other type of substance use. What we eat matters. You want to aim for an overall healthy eating pattern that includes whole foods, lots of fruits and vegetables, a lean protein, nuts, seeds, and cooking in non-tropical oils such as olive oil. They're healthier for you. To be more active, you'll want to get 2.5 hours of moderate or 75 minutes of vigorous physical activity per week. Definitely want to consult with a physician before starting any exercise programs or elevating them from your normal routine. Again, can't stress enough, quit tobacco. Use of inhaled nicotine delivery products, which includes traditional cigarettes, e-cigarettes, and vaping, is the leading cause of preventable death in the United States. So it's one of the highest risk factors that you can control. Get healthy sleep. Most adults need 7 to 9 hours of sleep each night. Adequate sleep promotes healing. It improves brain function. Your brain kind of cleanses during the night, and it reduces the risk of chronic diseases overall, not just for stroke and brain function. So manage your weight. Achieve and maintain a healthy weight has many benefits. Losing as little as 5 to 10 pounds has shown to make a significant difference in your risk for stroke or heart disease. You want to definitely control cholesterol. High levels of LDL, or the bad cholesterol, can lead to heart disease. Large amounts of cholesterol in the blood can build up and cause blood clots, leading to a stroke. And I'll show you some illustrations here in a bit. Manage blood sugar, and all these other comorbidities. So manage your blood sugar. Most of the food we eat is turned into glucose, or blood sugar, that our bodies use as energy. Our brain runs on glucose. So it's a good thing, but it's a good thing in moderation. So over time, high levels of blood sugar can damage your heart, your kidneys, your eyes, and your nerves if it's consistently elevated. If we were in person, I would have brought my water bottles. I like to show the difference, manage on blood sugar, and think about regular blood flow as water in a water bottle. Okay, it's flowing, it's going through. Now, what happens if you mix a little ketchup in there? It becomes thicker, a little more viscous, right? It's not flowing as well as the water bottle full of water. So it's a little thicker, gunkier. That's what your blood sugar looks like going through your veins when it's elevated. So again, a good image to think about. And then manage your blood pressure, okay? Levels less than 120/80 are optimal. High blood pressure is defined as 130/139/80/89. And high blood pressure or hypertension is a leading cause of stroke and the most significant controllable risk factor. It's right up there with quitting tobacco. And if you have known hypertension, you want to make sure you're compliant with your medications and controlling those risk factors to reduce your risk of stroke. So next slide, please. So again, another little fun graphic I borrowed from my coworker, but hypertension, since we're talking about it, it is a controllable risk factor, but not just for stroke, not for your brain, but heart attack, kidney disease. Blood pressure is the measurement of force applied to the artery walls. So if we're not quite sure what that is, what are we measuring when we have that blood pressure cuff on? It's that force applied to the artery walls. So next slide, please. So again, this is just another good illustration of what that looks like. A clear artery is on the left there. It shows that normal blood flow, nutrients, blood cells, everything getting through. And then on the right, you can see the abnormal blood flow as plaque starts to build and narrow. And then when that happens, again, that increases your blood pressure as it's forced through. Next slide. So when we talk about normal prehypertensive and hypertension with those blood pressure numbers, this is just another good illustration where you can see the normal would be flowing through the wider. Prehypertension shows some narrowing, and then the hypertension is when it becomes severely narrowed, and we want to definitely have that treated and control that. Next slide. I like graphics, so I just put them all in here. So another illustration and the importance. So next slide. I'm sorry, I just lost my screen for a second. All right, there we go. I'm back. So, all right, so remember, strokes happen, okay? And this is a good way to remember another acronym. We have BFAST, and that helps us identify stroke symptoms as they're happening. But strokes happen is another way, another mnemonic to remember what affects strokes, what you can control, what you can't control, and what your risk factors add up to be. So looking at this, smoking, blood thinners, rhythm changes such as, the atrial fibrillation, if you have it, if you oral contraceptives, family history, excessive weight, age, again, something we can't necessarily control, but it's definitely, it's still a risk factor as we get older. And then hypertension, take your meds as they're prescribed, control it at home, monitor at home. I see a lot of chat going on, about being able to know your numbers. Employee Health, offers blood checks. Personify Health stations are all over the place. I'm sure Julie could help direct you to those. Physical inactivity, get moving. If you have a sedentary job, take exercise breaks. Again, previous TIAs, mini strokes, transient ischemic attacks, you definitely want to ensure that you have a plan if you've experienced one of those, and you have the appropriate medical attention to prevent a major stroke. Controlling your blood glucose elevated, and potential an aneurysm as well. So for more information, we do have a lot of localized information, both through wellness at the hospitals, in the clinics. You can always reach out to me, but for stroke.org, which is the American Heart Association, they also have resources for survivors of stroke, not just general education, but if you are a survivor of stroke or know someone who is, they also have, great resources for that. So, and last slide. So I just want to say thank you all for inviting me today. I hope you learned something and understand, and I hope that you would be able to recognize a stroke if you saw one. Sometimes I'm not sure where you all are working from today, but you could potentially, if you work in healthcare, you could always potentially be the first person to see the, so someone experiencing a stroke. So hopefully, you're equipped better today for both yourself and others. And thank you.
Thank you so much, Crystal, and thank you all for being here. Several of you have shared how stroke has affected your family, and we appreciate you sharing, and it just brings up a great point. I want to challenge you today to think about making some of the changes that Crystal mentioned under the lifestyle section. But if not, then please go and share this information with others. If you have a loved one or a family member whose blood pressure is not under control, or whose diabetes is not under control, or they're a smoker, just make sure that you share this information with them, because this is such very important information. And again, I don't think I have any questions here. Another reminder to be aware of symptoms, the importance of taking blood pressure medication. I'll just mention again the Personify Health stations, which are located throughout the system. I'm happy to share more information about that with you. And also, you can always stop by Employee Health, and they will check your blood pressure as well. Okay. I don't see questions. Just lots of great comments, lots of praise for you, Crystal. So again, thank you so much for sharing this wonderful information with us. And I will look forward to seeing you all in May for all of our mental health webinars. Have a great day, everybody.
Thank you all.
Bye.